that aspect, that question. You know, what initiatives are there for seniors and housing and taking care of the needs of seniors moving forward? And this may go outside of the housing realm for you, but I figured you might have something.
Thanks. I can just speak briefly on CDC's just kind of how we see the graying of America, and I mean it's a critical issue for public health as well as for urban planning and transportation planning to recognize what this means, that our population is getting older. CDC has been either doing and or supporting a significant amount of research on what an aging population needs, specifically the aging population that we have, the baby boomers, who are very different from populations that came before them, as well as research on the concepts of living in place, universal design, and what components are most effective in helping people to be to remain healthy and autonomous as part of a community and active in their community over time. So although CDC, the programming that we have is focused in different areas that can touch on living in, or universal design and aging in place, they might sound a little different. So it might be programs related to healthy housing, might be programs related to physical activity or chronic disease prevention, with focus on aging populations.
Go ahead.
Gil, I wanted to comment just for a second. You mentioned at the beginning about speaking to maybe examples of what didn't work, and I think if we wanted to have something to give us a visual, we have it here as well, unfortunately, and that would be for public housing. That would be Shepherd Square. When you think about inefficient building, when you think about now. The structure of buildings were made much differently. We were barrack style. We did things differently when we started public housing because it wasn't always intended for families to live in originally. But as we have moved populations of families into those communities, we have environments now that are energy inefficient, that have no value to them in terms of the environment. There is no the livability is questionable because we have structures where we have costs that kind of prohibit households from really making them truly affordable as they were intended to be. So you have structures that create an environment for people that not only it can be dangerous in terms of their health, but it can also be dangerous, or it also can be kind of a barrier for them in terms of them being able to move up into their economic level and being able to move up and move into something that is better suited for a family. So that I think that would be maybe a visual that you could use if you were thinking of what doesn't work in terms of housing.
Okay. Yes.
I would just also like to talk, again, I'm Pat Green from South Carolina, not knowing enough about Kentucky, but I'm representing our Fair Housing and Equal Opportunity Director here. One of the things that did not work for us, at least in Region 4, which encompasses about 8 states, affordable housing units had been clustered in certain areas. Too often we've seen these affordable units in inner cities, and out in the suburban areas we did not have enough affordable units. One national case that has come to our light now, Westchester, New York, where affordable units were placed only in their inner city, and this city, being an entitlement grantee receiving federal dollars, did not place affordable units outside of concentrated areas. So now they are under a national order to go in and make affordable units outside of concentrated areas. So I think site and neighborhood is certainly one of the areas that we have to be more proactive by ensuring that sites are chosen in areas across racial lines, across certain areas, so that all persons will have equal access to those units that are affordable.
I'd like to touch on, because I see there's an interest here in renovating existing housing and sustaining existing buildings. Can green or retrofit be tweaked for improvement? And just see how that plays into what you all are doing now. And then if you'll come up to behind the camera, I'll take your question after this one.
Most of the community development block grant money that Louisville and other cities receive for many, many years has gone for housing rehabilitation. It is probably accounts on a national scale probably for 70% of the CDBG expenditures. In Louisville, over the last couple of years, we worked closely, our office worked very closely with some of the nonprofit communities to try to assist enhancing the capacity of those housing development organizations to do renovation and rehabilitation. Rehabilitation, particularly of some of the older units, and Louisville has a plethora of very old housing stock, is a real challenge. And because when you go into a building like that, you don't necessarily know what's behind that wall, and it can be very expensive. But we worked with some of the nonprofits and the Community Design Center here in Louisville Metro to do some efforts to build that capacity, and recently some of the nonprofits have successfully done some intercity rehabilitation for sale in some of the older neighborhoods. I recently went to an open house for one down on Liberty, and it was a very nice house. It was sold at an affordable rate, and they are undertaking additional rehabilitation. So it is something that HUD certainly supports, and the city is very interested in trying to do.
We've also done a substantial amount of rehab. A lot of some of our recent work has been in converting old schools into affordable housing, and there are several here in the community, St. Cecilia, St. Denis, that if you have an opportunity to take a look, I think you would see what can be done.
We have recently, in public housing, we receive funding to improve or modernize the units that we have, but in addition to that, we receive, you may be familiar with the Hope 6 grants, which create entirely new communities from obsolete public housing stock. In addition to that, last year alone, through the American Recovery Reinvestment Act, we issued $4 billion nationwide, and $3 billion of that was given to public housing agencies to improve their existing housing stock, with emphasis on green building. An additional $1 billion was competitive, and a big part of that competitive process for them to be funded was to make sustainable communities and to use energy efficient practices in both building and in creating environments. So we do that as well.
I'd like to move on to one other question from a non-text source here.